Hi, I'm Dr. John Lynch, Naturopathic doctor in Canoga Park, California, and I have liposarcoma. It's a very rare form of cancer. It's a connective tissue cancer. It could show up anywhere in the body. In my case, it showed up in the lower right quadrant of the abdomen, and I've used various therapies to deal with this over the years. And really, I feel under most circumstances, a doctor like myself who's trained in both natural and conventional medicine, who takes the same years to graduate as a medical doctor before we get our diplomas, same classes. We're trained in both natural and conventional medicine. We use whatever's best for the patient. And I needed both natural and conventional therapy. Therapy which was denied me because I couldn't afford the insurance and got caught with cancer, and after that you have a pre-existing condition where you're not going to get insurance. With my cancer coming before my career took off, before we even got licensing in California, I feel very unfairly given a death sentence because there came a point where I could have gotten surgery when it was needed after recurrence, and the surgeon was available, was willing to do the surgery, but the funding was not. And if I lived in Europe, it would have been different. I would have gotten the surgery for my liposarcoma. And now I'm told I have one month to live. And I'm turning my practice over to another doctor, Dr. Sherdine Graham, a very brilliant naturopath.
Hello, my name is Dr. Sherdine Graham, and I'm a naturopathic doctor. Just recently, I've been asked to temporarily take over the practice of Dr. John Lynch. He has been diagnosed with cancer, and due to the nature of the U.S. healthcare system, a cancer that that he could have taken care of, gotten surgery, gotten it removed, because there was no health care offered to him, the cancer has progressed, and just recently he was given a very negative prognosis that he only had 1 month to live. And so as a result, he's asked me to come in to help him. So I feel that that situation should not have occurred. If there was universal health care in America that covered both conventional, allopathic medicine as well as naturopathic medicine. Most people are familiar with conventional medicine. That's the medicine that where medications are prescribed, drugs are prescribed, surgery is prescribed. But there's also another form of medicine that's called naturopathic medicine, which is a branch of natural medicine. And with that type of medicine, the focus is on using nutrition, using herbs, using homeopathy, using mind-body therapies because the mind affects the body, using things of that nature in order to heal the body. And it's a shame, in my opinion, as a human being and also as a doctor, that in America, people don't have the choice. They're not given the choice to have conventional and natural therapies.
I myself could not have survived without the naturopathic therapies that I have used for my own cancer. But I also needed the surgery 4 years ago that I got that saved my life. They thought the cancer would return in 6 months. It took 4 years because of all the natural therapy I was using. At this point, I wish I was even going more aggressive with the naturopathic care to have prevented it from coming back altogether. And about 9 months ago, they said I'd be dead in about 3 months. And I stepped up my therapy quite aggressively. Been doing high-dose IVC, and that's been helping out a lot. And the National Institute of Health, the NIH, came out August 4th, and having redone Linus Pauling's work, using IV administration as opposed to oral, they found that vitamin C does indeed work very well. It had been done prior using oral methods, even though Linus Pauling did intravenous therapy, and that's why they found vitamin C to be ineffective. But now doing it with IV, they found that the cancer therapy worked quite well, intravenously, high doses. I'd been using 75 grams, maybe 2-3 times a week, when I really should have been using 100 to 150 grams a day. And that might have gotten me out of the problem I'm in right now, which is, once again, an inoperable cancer. We had that 4 years ago, and we found a brilliant surgeon who was able to handle it. But even now, that surgeon considers it inoperable. He was going to do the surgery 9 months ago, and they said I had 3 months to live, though 23 other doctors in the tumor board would not. They thought it was inoperable. They all thought that if anybody could do it, he could. Dr. Donald Skinner, a very brilliant urologist, head of the urology department at Norris Cancer Hospital at USC. And if I was living in Canada or England or France, I would have gotten my therapy then. I would have gotten my surgery. And I recovered from a horrendous case 4 years ago, and I know I would have recovered this time. And because I haven't had access to insurance, I'm now faced with a cancer where they say I have a month to live, and unless I can get enough high-dose vitamin C and reverse the trend, which I personally feel would be a miracle, my wife has a lot more hope than I do, I'm not going to survive. This is my wife, Suzanne Strawn, and she is the owner of In the Mudra Yoga and Dance and an amazing massage therapist here at the office. And of course, more than the love of my life, the mind-body aspect of healing is very important. Whether you laugh, you're grateful, whether you're happy, and my wife is very happy. And she spreads that happiness to others, including myself. And she's at least half the therapy. So why don't you, honey, tell them, your take on all this, and how you've been helping me out with your wonderful gift and keeping my attitude up.
Well, as my husband said that he was only doing a third of the therapies that he should have been doing. If our healthcare system was really working for people's health, he would have had insurance. He had a pre-existing condition that prevented him from having insurance. And when Dr. Skinner would have done the surgery, we also didn't qualify for Medi-Cal. And his dad actually wanted him to stop his practice, and that would have killed him, just giving up his career. He loves helping people, and in fact, you can tell that he thinks more about me, he thinks more about his patients and everybody else, more so than himself.
Yeah, this is high-dose vitamin C, and if anything could save me under these circumstances and give me the miracle I need to survive, it would be 100 to 150 grams every day. Unfortunately, the cost is way beyond our means. Our credit cards ran way up, and we, because of I had to spend the money myself for my own naturopathic therapies, and not having insurance at the time, devastated our finances, like many people that are uninsured in this country, and they have a catastrophic illness. Breast milk, human breast milk, is another good therapy for cancer. And there's some good research from Scandinavia about that. We've employed that, various herbs and vitamins. Juicing is really important. Fresh fruits and vegetables have proven cancer-fighting properties. But as I alluded to before, one of the most important therapies is your attitude. Whether you're laughing, grateful, happy about life. These are the things that can keep you alive. There have been people who were told they're going to die in a week, and they survive for years, if not decades, because of the compassion in their hearts, their laughter, their genuine zest for life, and it makes all the difference in the world. So I always encourage my patients to be happy, rent comedies, laugh a lot. There was a man named Norman Cousins who wrote a book called Anatomy of an Illness, and he was told he was going to die. So he had Marx Brothers films, brought in projectors in the hospital room, and by watching comedies and laughing a lot, he had the mind-body therapy to take things under control, and he survived.